Designing Care by Richard M. J. Bohmer. Summary of Chapter 8. In the book, Bohmer mentions an operating system for managing care that comprises two linked loops that function as a delivery cycle and a learning cycle. At the intersection of the two loops, linking them together, are the core processes of care, the decisions and tasks of daily patient care, iterative and sequential. This care management model integrates the various structures, capabilities, and actions that were discussed in previous chapters, and illustrates the work required to manage care and control complex healthcare delivery organizations. Bohmer mentions 6 capabilities that are each essential for organizations that manage care. An integrated design for care delivery and learning from care depends on these. An example of an organization that has reached a successful system is Intermountain Healthcare. It's a nonprofit company in Utah with 22 hospitals, 185 clinics, and 33,000 employees. It's so good, even the president likes it. Let's give you an example from Intermountain Healthcare from each one of these capabilities. Operating capability. Intermountain Healthcare's idea is make it easy to do it right. And to help achieve this, they have, for example, their information system with the electronic medical record with special features, such as the antibiotic assistant and also the ventilator settings, all to support the decision-making associated with routine care. Performance measurement. Well, for example, they collect their outcome data for their performance measurements. One example is their compilation of savings from different clinical projects in 1995. The subtotal of cost structure improvement was $20.7 million. An example of both production control and anomaly detection is the Intermountain Healthcare's influence mechanism. If the physician chose to not follow in the protocol, they had to type the reason for varying into the system. This function was designed with the aim to learn from exceptions, leading to adjustments and redesign. No protocol fits every patient, and no protocol fits any patient. Analysis. Well, one example of an analysis made by Intermountain Healthcare was that their clinical improvement projects routinely showed significant cost savings, but the administrators kept complaining that they were not seeing improvements in their operating budgets. Net operating income was not improving, even though documented cost reductions suggested they should. An example of adjustments and redesign is the new protocol that Intermountain Healthcare designed for community-acquired pneumonia, which led to reduction of average length of stay, time to antibiotics, and average cost per case. Let's talk about examples from the Swedish medical healthcare system for each one of these capabilities. Let's start with operating. Okay, so the concept was make it easy to do it right. And an example for Sweden is our electronic medical record with special features such as possible interaction of drugs and other warnings about, for example, allergies that the patient has. Let's move on to performance measurement. Performance improvement outcome data. In Sweden, there are both local systems and the authority called Swedish Council on Health Technology Assessment. Phew, that's a long name. For short, we say SBU. They perform evaluation of the methods used in the healthcare and assess the benefits, risks, and costs of the methods. The characteristics of production control is financial and non-financial incentives and sanctions that influence provider behavior. The hospitals in Sweden are divided into different clinics and departments with defined areas of work. With this follows different budget plans and resource distribution. Anomaly detection. In the Swedish healthcare system, anomaly reporting is a keystone for improvement of the quality and safety in healthcare. We report deviation from normal routines and also negative events and risky incidents. Let's move on to analysis. So in Sweden we have local systems for evaluation and also our dear Swedish Council on Health Technology Assessment, SBU. The aim is to analyze the work in order to improve. Last but not least, adjustment and redesign. The process of adjustment and redesign aims to improve the healthcare system. Both politics and knowledge play a key role. A new reform in the Swedish healthcare system is our free choice of healthcare provider. And that's all, folks. Thanks for listening. And don't forget to read the book Designing Care.